Welcome back. Hope you're all doing well. I hope that you and your families have managed to stay healthy and avoid this virus. I hope you're staying active. I found myself up on my 2-story roof the other day cleaning leaves out of gutters, of all things. Not the lowest risk activity in the world and something I've been putting off for quite a while, but I felt accomplished and it was an adventure. So, as mentioned in my last message, many of you will be overdue to see us for your hygiene services based on the shelter-in-place guidelines. But that said, I want to give you every opportunity to sort of step up your own plaque controlling game at home so that you can help prevent deterioration of your tissues and bone that support your teeth, avoid cavities, and just reduce inflammation, which puts you at risk for systemic problems like heart disease, stroke, and other things. So first of all, you should be toothbrushing minimally twice per day and for 2 minutes at a time. Ideally, you're using an electric toothbrush, Sonicare or an Oral-B, the common heavy hitters. This one's an Oral-B. The nice thing about electric toothbrushes too is that they do have timers, so you can ensure you're actually doing the toothbrushing for an adequate amount of time. Studies consistently show that electric toothbrushes are superior to manual toothbrushing in terms of effective plaque control. So if you're using a manual toothbrush, you just want to make sure that the toothbrush bristles are soft, okay? Anything other than soft bristled toothbrushes are too harsh to the tissues and actually can cause damage to the surfaces of your teeth. So we're talking 2-finger pressure, very light, okay? Plaque is soft. The bristles need to be soft and the pressure needs to be soft. So don't manhandle your toothbrush like you're, like trying to tear old paint off a house or something. So easy does it. And, whether it's a manual or electric toothbrush, you want to be replacing the bristles or the toothbrush itself in the case of a manual about every 3 months, okay? So this is really critical, but you want to focus on the angle of toothbrushing. This is really critical. Plaque tends to accumulate along the gum line. So you want to make sure that you're angling the toothbrush at about a 45-degree angle right into the tissue, okay? Angle's critical, okay? And don't forget the tongue side or the palatal side. A lot of you tend to sort of blaze over this area too quickly. Bacteria does not discriminate. So 45-degree angle, cheek side, 45-degree angle, tongue side. Okay, so per quadrant, it's cheek side, tongue side, and bite surface. Okay, and then don't forget to get way in the back. Okay, a lot of you are really good at brushing the front teeth clean, plaque free, but you got to get all the way to the back second molars. Okay, and then the other thing is to brush your tongue. Bacteria that cause gum disease reside on your tongue as well. So whether you brush your tongue or you use a tongue scraper, I would suggest you do that every time that you brush. To brush your teeth and not brush your tongue would be like washing your car and avoiding the hood. So clean your tongue every time you brush, and it may make you gag. That's okay. So get after it. Don't rush it. Establish a very definitive routine and stick with it, so that you don't omit certain areas in your own distraction. Let's face it, toothbrushing is a fairly mindless activity for most of us. Our minds drift off. We focus, especially right now, on maybe stressors. But the more you can spend this 2-minute period of time mindfully, actually focusing on the process, the better your oral health will be. And so good luck. Don't hesitate to reach out if you have any issues or any questions for me. Stay tuned for my next segment on dental flossing. Take care.